Recovery Reform is a podcast that provides educational content while addressing the stigma against drugs and the people who use them. Expertise meets lived experience as the hosts and their respective guests unpack the multifaceted cause that is recovery reform. Welcome back to the Recovery Reform Podcast. I'm here with my co-host, Dr. Taylor Nichols, and we're going to start doing some short videos, maybe a series where we're talking about specific substances, maybe even medications, things within that realm. And we're going to start off with a pretty controversial one today. And I'm going to start off by saying that we're going to speak on what I call Kratom, or what other people call Kratom. But we're also going to talk about something called 7-0, and we can also talk about mitragynine extracts. And I think it's important to acknowledge that people within this community, specifically people within the Kratom leaf community, do not want to be associated with 7-0 or mitragynine extracts. So I just want to say that in respect for those individuals. I also will push back on that a little bit later, but I wanted to ask you, like, as a physician, who works in clinic and who, works within the space of MOUD, and as a, emergency medicine physician, what have you seen when it comes to this? And let's try to be real specific with like Kratom, which is a separate product, obviously, than the extracts.
So when we're talking about Kratom or Kratom, there are multiple active, what we call alkaloids, within that leaf, the plant. Over 40 active alkaloids, but the predominant one is called mitragynine or mitragynine, depending on where you're from and how you say it. I like to say mitragynine. Anyways, that is the primary active alkaloid. That is both a stimulant, it provides stimulating effects, and it binds to opioid receptors. Now, as just the plant, it has less affinity or less binding strength and potency at opioid receptors, or what we're talking about is the mu opioid receptor when we generally talk about opioid. Now, the extracts, what we're talking about when you say 7-0, talking about 7-hydroxymitragynine or 7-hydroxymitragynine, depending on how you say it. It is a more potent and more active opioid, or a alkaloid that binds to the opioid receptor. So what we're seeing a lot of now is that this is unregulated. The plant is unregulated. The extracts are unregulated. They are now much higher potency, higher dosage and quantity. And what we're seeing is now a lot of what people are taking, thinking that it's just Kratom. It's actually 7-OH or 7-0. And it is really just, it's a potent opioid. And so they're taking high doses of this fairly frequently. And essentially, even though it's not defined as an opioid and it's not defined as opioid use disorder, they are developing what is yet to be defined as Kratom use disorder. It's not in the DSM as a use disorder like opioid use disorder is, but it's been described in the literature, and it's very clearly its own unique entity because mitragynine is such a unique alkaloid. But with 7-0 or 7-hydroxymitragynine, what we are seeing is predominantly opioid-like effects, opioid-like dependence, and opioid use disorder sort of features, which are responding to treatment for opioid use disorder, like buprenorphine. So we're having people who are coming into my addiction medicine clinic, for example, we're seeing a significant uptick in people who are coming in specifically for Kratom use or Kratom use disorder, and are seeing a pretty good success with treatment with buprenorphine for that specifically. And again, a lot of those people don't necessarily know that what they're taking is predominantly 7-hydroxymitragine. That's
Yeah.
predominantly the opioid extract of the actual kratom leaf, which is different, less potent, and not it's not as concentrated as it's extracted. So there's a significant difference, and a lot of what we're seeing on the market is really like doses that people don't recognize are problematic.
Yeah, for sure.
Which is the bigger problem. A lot of
Yeah.
people have used and can use kratom for sort of weaning themselves off of other opioids or other medications, but with these high doses and higher potency extracts, it's actually sort of causing the reverse effect. It's causing increased dependence, which folks sort of didn't go into it when they started taking them with the intention of increasing their dependence, and then sort of struggling now with something else. And the other part is sometimes people don't even recognize that they're taking essentially an opioid. Some of them are mixed with kava, and they're taking these kava drinks that have kratom in them that are actually fairly strong extracts, and then finding that they have become dependent on it as an opioid.
Yeah.
So I think those are sort of the things to be aware of. It's also, again, treatable, just like opioid use disorder is treatable with buprenorphine, methadone, that we can use the same medications, and they seem to be having a good effect on that. And again, a lot of that specific to 7-hydroxymitragine.
Yeah.
And like you said, the community of people who use kratom leaf and not the extracts, they have a different opinion of the way these extracts are marketed.
Yeah. Definitely. I think so. There's a couple of things that came up that I wanted to dive into. My understanding is that a lot of newer substances or things that are becoming more prevalent and prominent are grandfathered in when it comes to scheduling, and I don't know if that's accurate. I've heard that from people, and so I'm not really looking for like a solid answer, but it's just interesting how this is not like not unlike a lot of things that are analogs and stuff like that, you know what I mean, to where it kind of navigates that. So it's very interesting to see that.
It's more like a loophole in scheduling, because scheduling is specific to each substance. And so if something is not yet regulated or not yet defined, both in the literature by the DEA, et cetera, then it hasn't yet been scheduled. It's not restricted. So kratom and the extracts are not regulated at all, and they're sold essentially as a supplement.
Yeah.
And it's not scheduled as any specific schedule of the schedule 1 through 5 of different substances based on their quote unquote addictive potential and versus their medical use. And so some of these things would certainly fall on the schedule based on their similarities to other drugs that are scheduled.
Yeah.
However, they're not, because they haven't yet been specified as an individual substance. And so that is one thing around, we talked before about like RC drugs or research chemicals, different like benzos. Somebody can modify a drug. They can just add a component to it, and it'll change the actual chemical structure and naming convention. And that's a loophole, a way around the scheduling. That's how people can sort of sneak under the radar of something that is not yet regulated and scheduled. And so in this case, we have kratom is not a scheduled drug, and it is not regulated. It is considered a supplement, which are not regulated. here. And so it's actually been interesting to see the discussions, because a lot of times people don't want regulation or scheduling around drugs, especially their like drug of choice. But in the case of Kratom, the Kratom community, specifically like the leaf and not the extracts, they want the other things to be regulated.
Yeah, but not the leaf though.
Right. Because they want that differentiated.
Yes.
Right. And so that's where it becomes kind of tricky.
Yeah.
Because, and as they say, the devil's in the details, but you want to make sure that you're talking about what is the substance, what's the concentration, that sort of thing.
Yeah.
And there's certainly reason to believe that that's a more responsible way to go about it if you're looking at scheduling a specific drug. We're talking about high concentration extracts of, specifically, like in this case, we'd be talking about 7-OH. Versus the leaf itself. And again, we haven't been seeing the same kinds of problems with just the leaf itself as we're seeing with 7-OH products associated with the extracts.
Yeah. I think that it's interesting too when you look at similarities within like the cannabis space, and you have like natural cannabis flower as opposed to extracts, and the extracts are going to be more stigmatized. There's a little bit different paraphernalia even tied to consuming those things, and so but also at the same time with more concentrated versions of something, that there usually can be more side effects tied to that, and so there needs to be more education and mindfulness when you consume these things. And that's where the issue that a lot of people raise with like head shops and smoke shops and corner stores or gas stations having this stuff. And that's why now there's this idea that I've heard it from many people, that metragenine or 7-O is like gas station heroin, which I think is unhelpful and stigmatizing. But there's validity when we talk about lack of education when it comes to people that are selling this and the people who are buying it and consuming it. And I think that just so people know, like, you should absolutely vet something very, very thoroughly before you put it into your body, and not just take anyone's word for it at all. And also, I'll say this: suggested doses, that doesn't mean that you should start with that suggested dose. It means you maybe should do significantly less,
And to be clear, the suggested dose for these, we're talking much lower than what is actually readily available. Which is like kind of remarkable. I mean, granted, we're seeing that now in cannabis spaces too, with extracts, or even not extracts, but just the higher potency of what is made available in terms of flower itself. Versus in the past. So you have a higher potency for just the flower, and then you're talking about extracts on top of that. And so we're seeing a similar effect within Kratom in that space with the extracts and higher potency. And so the actual recommended dose is lower than what is even necessarily readily available, that people are sort of starting with. The other thing that just to clarify, people are talking about like gas station heroin. There is another substance called tianeptine that is also often called gas station heroin. It also activates opioid receptors. I am not seeing that as much where I am, but I've certainly heard from a lot of other people that is becoming more and more common. These things are readily available. And in terms of what you're saying about you should know what is you are putting it in your body, like, in my opinion, from the physician standpoint, talking about informed consent, do people have a right to autonomy? Yes. Should they be adequately warned and informed about what they are using? Absolutely. Not only for safety reasons, but just so people have adequate information, and that things are appropriately labeled and marketed as what they are. So people know that like, oh, this is an opioid. A lot of people just have no concept of that who are starting to use them because they're readily available. They don't think that, oh, well, this supplement is an opioid, right? They don't think necessarily that they're using something that is sort of more potent than prescription pills in some instances, right?
Yeah.
So I think I think it's an important discussion that we have, whether or not things get regulated in terms of dose and potency and quantity, or whether they get scheduled or not. I think it's the most important thing in my mind is that things are appropriately labeled, people are adequately informed, they have warning labels on them, and that they're not deceptively marketed or located in places like gas stations, for example. So
Yeah.
I think it's a difficult discussion to have because there are a lot of strong opinions on all sides
Yeah.
of this conversation. But I do think the most important thing that I think we can all agree on is that people deserve to have informed consent about what they're putting in their body.
Facts, 100%. And for a little bit, I'll kind of rant if you're cool with that, because there's so many
Please.
things I've been talking about, specifically 7.0 and mitragynine on TikTok. And I'm in alignment with what you're saying 100%. When it comes to informed consent, we talk about it all the time. It's something that I believe in. I think that peers can advocate for informed consent. That is not always something that's between a provider and their patient. It's something that we should culturally engage in, and that should be the spirit of communicating and advocating with other people. See what this is. I'll raise some concerns when it comes to attempts to advocate on behalf of others. So what we're seeing is the same rhetoric that's authoritarian and paternalistic, and that's what I'm seeing. Now, it's okay to raise valid concerns, 100%. People need to know that if you take something, like this consistently, that you're going to very, very likely, at least with mitragynine extracts and 7.0, you're going to have symptoms associated with the consumption of it, very likely, and then the discontinuation of it. And people need to know that. That does not then make this some monster that's out to get you and that is, inherently addictive. I think people need to understand that these things can cause dependency when taken consistently, and that there's a difference between that and this being, again, this boogie monster that's going to impose this addiction on you, and it's very dependent, like we talk about a lot, on dose. So what's happening is a lot of people, let's just look at mitragynine, extract shots. People drink the whole thing. Generally, that's what they're doing.
If not multiple.
Yeah, and multiple. But usually the first time ever consuming it is taking the whole thing, which is not the recommended dose. So you start off with that. Now, I'm not demonizing people that are consuming more of something than it's suggested. I think a lot of times people, they know their own bodies and they're seeking relief, and they're, evaluating that and applying these things, consuming these things accordingly. But with that being said, that's starting off not from an educated place, not from an informed place. You're just mindlessly consuming something. And we see that culture with, again, gas stations and smoke shops. So, and just to kind of like wrap up this portion of my rant, I'll say that I believe in dispensaries for this. That's what I believe in, very similar to cannabis. And even if they wanted to associate that with cannabis, and sell it in the same type of dispensary, that's fine. Those places, they ID you when you go in. Right. Those spaces are going to have, some, there's regulation when it comes to testing and all this other stuff.
Highly regulated.
Yeah. So it's like that to me makes sense. I get scared, when it's like, hey, let's regulate this, and turn this into like a pharmaceutical product. That's where I'm like, oh, because usually when we're talking about regulation in that realm, and then like the medical and clinical space, it, in my opinion, leads to overregulation and restriction for many people, especially when we're considering what how this affects the brain and the receptors that it hits, that's immediately something that will be less accessible to the majority of people, specifically people with opioid use disorder. And then obviously we've seen where chronic pain patients are at. So
Yeah.
this is something that is a lifeline for some people and
Yeah.
is becoming a disaster for others.
Yeah.
But it's very dependent on just the way that someone engages with this.
Absolutely. Well, one of the things we've talked about before in terms of set, you mentioned dose.
Yeah.
Dose. You have to be informed about to know what dose you're taking, first of all. So in informed consent and information about the actual substance that you're using, the appropriate dose to use it at, and then setting. Like, what is your intention? What are you using for? You can't even do that well or do that right if you don't know what you're doing or how much you're doing or why you're doing it, right?
Yeah.
So and I'm not talking about regulation from a pharmaceutical standpoint, making it a pharmaceutical, but I am talking about putting it in a location that is more regulated.
Yeah.
And I think there is a lot of room that we have in terms of adjusting the availability more appropriately. You can say it that way, like having it in gas stations where people aren't adequately informed necessarily, and the people who are there aren't there to be informed about Kratom or mitragynine or 7-OH, right? But if you go to a dispensary, if you go to a cannabis dispensary, they'll be knowledgeable and be able to talk to you about products that are there, dose, what the effects, that sort of thing.
Yeah.
If you regulated this in a similar way in terms of the location and the availability, in that sense, then absolutely. I think that would be a more appropriate way to ensure that the people who are buying and using this are adequately informed about what it is that they're using, what the dose is, what the appropriate like volume, right? If it's like not taking the whole shot, be informed about what an individual starting dose that's appropriate, or a serving size as it were, like if it was like a food label, right? And so I think I agree with you on that. I think it's not about the substance itself. It's not about over regulating it. It's not about making it a pharmaceutical, specifically not a pharmaceutical, but it does deserve to be regulated in such a way that it ensures appropriate informed consent of the people who are using the substance. And I think that's true for any psychoactive substance, frankly. Anything that can cause dependence, that can cause harm, that people can become addicted to. Now, to your point about like the substances being inherently addictive, I think that's a very interesting discussion for another time. But they certainly, there's a difference between physiologic dependence and addiction. Addiction is a behavioral disorder, which really isn't dictated by a substance. Substances aren't sentient. They don't make you do anything, but they can cause tolerance and withdrawal, which define physiologic dependence, right? So I think it's important that we distinguish that separately from addiction, and we talk about those things differently. And yes, if something can lead to physiologic dependence, that should absolutely be appropriately regulated in terms of the setting in which it can be dispensed, making sure that people are able to be adequately informed, making sure that people that are selling it are adequately informed about the substance that they're selling and can adequately inform customers, right? So I'm with you on that. I think it's an important conversation to have. And about Kratom and, pretty much any other psychoactive substance that is readily available. Like I said, I mentioned tianeptine is the other thing that is being referred to as gas station heroin. That would also, I think, be appropriate to be sold in a setting where people can be adequately informed.
Yeah. I mean, when it comes to like, my beliefs, a lot of times they could be definitely labeled as like radical in regard to like personal autonomy and bodily autonomy when it comes to consuming things. With that being said, I don't see an issue with the dispensary setting when you consider that often like what this is going to do is, in many scenarios it's going to increase, awareness and sometimes even accessibility. There can be barriers like when it comes to something being structured like that people are like maybe more scared to engage in that type of setting. But with that being said, like the way that it is now is, the vibe, if you will, of people that are going into gas stations and smoke shops is usually it's like a passive thing, and like maybe there's something that you're going in there intentionally to get, but this is now becoming like an afterthought for people. Like they go in and they're not even going in to get that, and then now they're getting it, and some dude is like, "Yo, bro, check this out," or like. But what we are also from peers and other people out there, they're also being very heavily discouraged from trying it by people working specifically in smoke shops and head shops. Is that you actually will hear a lot of people who are straight up saying, "Don't try this, don't take this at all." And I think that there's a middle ground that's not demonizing it or completely denying any of the potential negatives. And I want to definitely disclose that I have tried 7.0, I've tried metragenine extracts, I've tried kratom leaf powder. And because I am, really over the top when it comes to like informed consent, I'm really looking into these things. I made sure when trying any of those things that I was dosing extremely moderately and that I was not continuing to consume it consecutively at all. And for me, as someone who was diagnosed with opioid use disorder, I was a little bit like hesitant. And for years, I was like, I'm not even going to try that. Then, I was having some chronic pain stuff and it was, somewhat effective. I think that personally, I don't really like the feeling of those types of substances anymore. I kind of had enough of them. And so I think maybe that's why I'm not having a compulsion inflamed. But the reason I bring this up is because I want to advocate on behalf of people who are not yet fully established, and I don't really like that terminology, but have not engaged in their own healing or recovery process for an extended period of time like I have. Your experience is valid if you are looking into these alternatives. You need to be, ideally be educated, but just in me expressing what I just did, I've been vilified by people, labeled as relapsed, all of these things. And that's okay because my worth is not tied to these ideas of sobriety and recovery. But there are many people out there whom it is, because that is they're motivated to engage in that, and that's what they're devoting their life to. And I just wanted to advocate on behalf of those people, as fellow people who use drugs, and just say, hey, like, your experience is valid. Just keep checking in with yourself, express any concerns you have, and adjust accordingly if you notice anything that's coming up that doesn't feel sustainable. This doesn't have to be a catastrophic thing. But if for the people out there who are experiencing withdrawal and all of that, I wanted to touch on something that Taylor mentioned. It is totally acceptable to go from something even like Kratom leaf to taking something like bupe or Suboxone. And we don't, I would discourage this natural versus pharmaceutical rhetoric to where it invalidates like very, very viable options for people on both sides. So we're going to see that with people invalidating what people call plant medicines. I don't like that term, but that's that's what I'll use to explain it right now. And then the same thing applies to specifically things like Suboxone. The idea that if you go from something natural to a pharmaceutical, that you've just fundamentally failed yourself, and that's just not true. It's all about what's applicable and what's effective, and ultimately you're the one that's going to have to decide that for yourself.
Absolutely. And from the pharmaceutical side of the argument, like we very specifically know exactly how this works. They're highly regulated. We know they're safe. Like there is a reason to have distrust in healthcare, pharmaceutical industry. I understand why people feel that way. At the same time, pharmaceuticals are incredibly useful tools that we should be able and willing to accept as part of the conversation,
Yeah.
and that they are the safest supply. As we know, they're the most regulated. So I appreciate you saying that. I think both are incredibly important aspects of the conversation for us to continue to have and make sure that people have access to treatment and information that can help them both use responsibly, use safely, and recover in the way that they feel is the most appropriate and constructive for them, which is exactly like what you're talking about right here. And I'm glad that you feel as strongly in the way that you do and as comfortable in your own recovery as you do, so that other people vilifying you for having used other things to help support your own recovery from your injuries and chronic pain as a result, people need to be able to respect that everybody's recovery looks different. So again, that's why we're here.
Yeah. No, thanks, brother. I appreciate that. You know, I just consider what, people who are new to this process would be feeling. And it also, I'll be completely transparent. It's extremely invalidating of the amount of time and effort that I'd put into my process. But that's not tied to, this idea of me seeing myself as valid just because of that amount of time. It's more so of like, just basic human decency and respecting other people, and this perception that if someone with the opioid use disorder tries something one time, that means it's over with. That means they're doing it every day. That means that their life has to now become unmanageable and they have to hit rock bottom. And, the truth is that when you respect your past experience, and you operate in accordance with that and acknowledgement of that, then that's a really, really solid roadmap, and just listening to your body and respecting that. And it's good to have, options out there that, are alternative and accessible. But I also understand that there are completely different dynamics when someone is experiencing, a sense of desperation and looking for resources. And then that can lead to lack of informed consent in pursuing something like these so-called supplements that we're talking about. And so I'm in a unique position of privilege because of the amount of stability that I've experienced over the years, and the fact that my immediate needs are met. And so I have to also acknowledge that, and just be very, very clear on that. I understand that people's circumstances are different. And, I just really just wanted to end with like, that people out there who have committed their life to whatever you want to call it, healing, recovery, whatever, that for many of us, I'm not trying to speak for anyone, we actually have to work on the rigidity when it comes to abstinence. And I think that is seen as a really wild statement to say like, oh, you should actually question abstinence. You should really see, are you not consuming something because of this idea of abstinence when it in fact could help you or increase your quality of life? And so that is something that, again, in me bringing up my experience in consuming these things at all, ultimately, this is one of the main things that I wanted to mention, is that I had to do a lot of work to even accept the fact that I could try anything that is, seen as potentially dangerous or euphoric. And because we police and we restrict euphoria. And so I think it's important for people to understand that this is not a abrupt, mindless decision that you should engage in. Also, at the same time, you should look at, that indoctrination and see if it's preventing you from entertaining certain things. And, in closing, I'll say I'm still dealing with that. I just spoke to Taylor before and said that I had a provider that was suggesting that I took a certain medication. And I was like, no, I'm not going to take that. And why is that? A lot of it is because of internalized stigma when it comes to taking something every day. But, we kind of have to evaluate that and look at that. And for me, my truth is that I don't want to take anything every day. So I can respect that, but I should also continue to look at why Why is it? Is it because of stigma? Is it because that's really something that I'm respecting? Is it because of outside influence in our culture or within recovery communities? So yeah, I appreciate the opportunity to speak on this when it comes to the belief systems that we've embodied, and to really just be very critical of that and evaluate, hey, are we suffering unnecessarily? And that definitely is the case for me in many scenarios. And it's taken work to accept that I could try to take something for that. you know,
It's such a good, are we suffering unnecessarily? That's a good way to phrase it. And again, not to invalidate anyone else's experience or recovery or their abstinence or the maintenance of their abstinence.
yeah,
If that's the thing that is the most appropriate for them, or they feel that they otherwise struggle if in pursuing their recovery the way that you have, that doesn't make their recovery any less valid.
no,
As long as you can do the sort of critical examination that you've done, like you talked about in terms of you're working with a healthcare provider, and your self-examination of like, is this because of stigma? Is this because of respecting my own desire, my own recovery process? I think those are all really important questions, and it should be individual, and working through all of those points is super important. I appreciate that you said that everyone's recovery is valid in the way that they see works for them the most. And I appreciate you sharing yours.
thanks,
I
brother.
appreciate your openness always.
I appreciate you. So yeah, we're gonna wrap it up. We'll do more of these that are a little bit shorter. And yeah, feel free to hit us up in the comment section if you're watching this on YouTube. Like and subscribe. We're on all the platforms. And yeah, we just appreciate everyone for watching and or listening.
Thanks so much. Bye.
Views and opinions discussed on this podcast are personal and do not reflect the views or opinions of our employers. Although medical and clinical topics may be discussed in this podcast, the information provided is not medical nor clinical advice. Thank you for watching and or listening.